The first thing that happens when the child comes into the office is they're seen by our nursing staff, and we get current vitals, weight. They get interviewed by the dentist, myself, and by our anesthesiologist, just to make sure that their NPO status, that they haven't eaten that day or drank anything that they're not supposed to. We make sure that the parents understand what they're here for and what the possibilities are of what treatment can be done. Once everyone's kind of on the same page, the child gets sedated with a sedative called Versed usually. It takes about 15 minutes for that to fully kick in. Once they're fully sedated, they go back into the OR suite where they're put under general anesthesia using an anesthetic gas. Once they fall asleep, an IV goes in their hand, so they actually never feel or never see the IV, which is great, especially for kids that are needle phobic. They get a breathing tube placed down their nose and into their lungs, which protects their airways at all time. Also keeps the anesthetic gases and the oxygen on so that they're comfortable, but they're also getting the proper oxygen levels. So once they're then asleep, we take a set of x-rays. After the x-rays are taken, we put a throw pack in, which is basically a long piece of gauze that we kind of snake back and forth into the oropharynx. And what that does is prevents any debris, any materials from going back into the stomach or even worse, the lungs. So by having that throw pack, it's just an extra safety measure that we have. Once that's in, then I always clean the teeth first. That way we can see exactly what's going on in that child's mouth. We're not going to be hindered by any plaque buildup or anything like that. We can see exactly every surface of every tooth, so we know where decay is, what needs to be treated. And so with that, along with the x-rays, we'll have an ideal treatment plan that that child needs exactly at that day. So that way, like I said, they can wake up with their mouth 100% healthy.